So now we'll review the instructions for abdominoplasty or tummy tuck surgery.
So after your tummy tuck surgery, you'll be spending the first night of recovery in an aftercare center, and you can definitely spend more nights if you'd like.
So when you wake up, you will be in a compression garment, and the most important thing is to keep the garment straight. You don't want to have any folds or creases or bend in it that will either make a permanent line or impression on your body or create a tight elastic band that may interrupt the circulation. So please be conscious of this during your entire recovery.
You're going to be in this compression garment for 6 weeks, so get to know it and love it.
Also, you will likely have drains, usually 2 or 3 drains after your surgery, and you do not want to get the drains wet. So you can bird bath around the drains, but you will have to wait until 2 days after the drains are removed in order to take a full shower or get your entire body wet. And for the drains, you will record the output every 12 hours.
Every 12 hours. So pick a time, 9 a.m. and 9 p.m., record the right, middle, and left amounts of the output, and then let us know, and we'll decide, Dr. Kat will decide when the drains are able to come out. Usually it's between 7 to 10 days.
Yes, and if you are having liposuction at the same time as the tummy tuck, or if you're a revision tummy tuck, sometimes it does take longer, so do not be alarmed if your drains need to stay in longer for about 2 weeks, sometimes 3 weeks. It's part of the course of having drains, and everyone is a little bit different in terms of how quickly they heal. Special positioning for tummy tuck surgery. So in the tummy tuck surgery, I'll be removing skin, pulling it down, and tightening it. So the first week, and sometimes even the second week, depending on how well you're healing, you will have to walk bent over. And I mean bent over, let me show you,
yes,
Veronica.
Like
it's gonna have to be like this.
Really bent over.
We're talking about 20 to 30 degrees. So I know that you're going to feel great after your surgery. Most of my patients are off prescription pain medication after a day or two.
It's crazy.
But it's still important to protect your surgery site. You don't want to create any undue tension on my repair. So please be conscious of that. And if your back is sore or you tend to have back pain, you can get a front wheel walker from the pharmacy.
Yeah, those are awesome. Our patients come in with their walker, they put all the pressure on the walker, and then it relieves your lower back.
And when you are lying in bed, the same position holds. So you need to be sitting up, propped up with several pillows. Flex your knees so that way you're always bent, especially for the first week. It is very important.
And after the course of the first week, you'll feel that you're able to stand up a little bit straighter, and it just takes time for your body to be able to adjust to your new tight and flat, awesome tummy.
Now, activity. So the first night of your surgery, you will need to start walking. And you're gonna walk every other hour, nothing crazy or strenuous.
Yeah, just walk around the house or just make sure that you get your blood flowing.
Yes, and you will also need to make sure that when you're getting in and out of bed, you're not using your stomach muscles. So have someone come from behind and help you out of bed, because I'm going to be putting a lot of sutures in the abdominal area. We do not want you to create any tension on those particular sutures. So the first 2 weeks, just gentle walking.
Yep, very carefully in and out of bed, and you can stand straight up as needed.
After 2 weeks, you can do more extensive cardio like walking uphill, but you'll have to wait for a full 6 weeks, six weeks before you do any exercise or heavy lifting. Did everyone hear 6 weeks? Because everyone always asks.
How many weeks?
6 weeks.
6. In your recovery after having a tummy tuck, you'll just start your normal diet as tolerated. So definitely we'll start you on clear liquids, and then you can gradually move up to the normal foods that you eat.
We just don't want you to get nauseous, especially that first 24 hours after surgery when you may still have some anesthesia in your system. If you're taking prescription pain medications, you just want to take it easy on the food, because we do not want you to throw up right after you have your tummy tuck surgery. After that, just stick to healthy foods that are rich in antioxidants and protein. Those are all great for healing.
So at around 3 to 4 weeks after your surgery, we can begin thinking about the scar therapy treatment, meaning what we're going to do to make sure that you have the most invisible scar as possible.
And as you know, just please keep in mind, it does take a full 2 years for the scars to completely fade. All the sutures are dissolvable, and the tapes that we put on your incision, the Steri-Strips, will slowly roll off. You can just trim them, but at 3 weeks, when we do start the scar therapy, you can very carefully remove the Steri-Strips and start the scar therapy.
After your surgery, you also might be a little bit bruised and swollen, but that's totally normal. This will last for about 2 weeks after your surgery, but it actually does take 3 to 4 months for all the swelling to completely go down.
And it is normal to also have some bloating or feel a little full after your surgery, especially if you have a hernia surgery in conjunction with your abdominoplasty. And for that, you can sometimes stay bloated up to 4 to 6 months. It's completely normal. We recommend that patients start Miralax, Exless, any of those type of anti-constipation medications are fine after your surgery, and you can do that even the night of your surgery to help with the bloating and the constipation.
So if you develop a fever or you notice any dark red blood going into your drains, then you can definitely call the office and let us know what's going on, and we will direct you as for next steps.
And usually if there is something that is an emergency, it's not subtle. You will see the drains start to fill with blood, you'll get immediate swelling, pain, bruising. It's usually not subtle. So if that occurs, then please call the office urgently. But other than that, a little bit of bruising, a little bit of swelling is totally normal. And then just relax and enjoy the process. Your anesthesia experience should be amazing. Like, you'll feel like you took the best nap of your life.
I know. I'm always jealous of the patients that they get to take like an 8-hour nap uninterrupted and then wake up looking amazing.
Think positive thoughts and support yourself with positive people.